Choosing a health insurance plan and figuring out how much it will really cost you can be a stressful process. Knowing which features of a plan matter most to you can make the difference between choosing a plan you love and a plan you can barely live with. So before you start to evaluate your health plan options this open enrollment season, make sure you fully understand different types of health plans available. Let's start by explaining how health insurance works. You pay a monthly premium in exchange for your coverage. Preventative care, such as checkups and other well visits, are typically fully covered by your plan. Beyond that, you are responsible for paying out of pocket for additional healthcare services, such as sick visits and prescriptions, up to a certain dollar amount called a deductible. Now let's talk about the difference between different types of plans. Think of traditional health plans as a pay-up-front model, where you pay more upfront for richer coverage to minimize the required out-of-pocket spending, but you may be paying for coverage you don't really need. On the other hand, consumer-directed health plans, or CDHPs, typically offer reduced premiums so you'll have lower monthly costs but a higher deductible, which means higher out-of-pocket costs. You can think of CDHPs as more of a pay-as-you-go model, where you pay for only what you need, which translates into direct savings for you. CDHPs are often paired with tax-advantaged savings accounts, like HSAs and HRAs, that enable you to save on out-of-pocket costs by using pre-tax dollars. Your employer may even be partially funding these accounts for you to offset costs not covered by your plan. When you factor in the premium savings associated with CDHPs, coupled with the tax savings of using pre-tax dollars to pay for out-of-pocket expenses, they are often more cost-effective than traditional plan options, despite the higher deductible. Here are some important questions to ask yourself to determine whether a CDHP is right for you. How's your health? When it comes to saving money on healthcare, one of the best ways to spend less is to stay healthy. Healthier individuals consume less healthcare and have even greater potential for savings with a CDHP. Do you want more control over your healthcare finances? CDHPs trade lower premiums for higher deductibles, which means you pay for your medical expenses out of your own pocket until you hit your deductible. However, greater control means greater opportunity for savings. Are you a savvy shopper? Would you be willing to shop around for the best price on routine orders like prescriptions or blood work? With a CDHP, savvier shopping translates into more savings for you. Do you worry about rising healthcare costs? If cost concerns keep you up at night, a CDHP might help you get some sleep. An HSA can help you build wealth for the future, and taking more control of what you spend by price shopping and actively managing your healthcare finances can help you feel more empowered and less anxious. Whichever plan you choose, do your homework first so you can make an informed decision and ensure you get the best fit and value for you and your family.